Welcome back. Plastic and the negative effects it could have on expectant mothers grabbing our attention this morning. A new study shows synthetic chemicals found inside plastics products, can cause premature birth. WWL Louisiana Chief Medical Correspondent Dr. Hebert sharing guidance on this. I mean, plastic's in everything.
It's in everything. And what's scary? The real scary part about this is that these phthalates, those are the things that really cause these problems. They're found in things like soap. They're found in things like hairspray. They're found in things like shampoo. They're in everything. And it could be tied to more than 56,000 preterm births in the United States. They looked at about 5,006 dyads, right? So those are mother and daughter and mother and son combos. And they looked at this and they saw that there is a decrease in the preterm gestational birth. They also found this decrease in the amount of the ability of a woman to bring this child all the way to term. And this is a major problem because we have seen this over the years that this decrease in this gestational age, and this is a problem because the earlier you come out, the earlier you're going to be exposed to things that you really shouldn't be exposed to as a newborn, and that decreases your ability to survive, and that's just a bad thing. So how do you avoid this? You can't avoid plastics, right? So if one thing you could do, quit drinking out of so many of these plastic disposable water bottles and use natural products when you clean your hair and your body.
That's one helpful advice, absolutely. Okay, I think this one is pretty exciting, actually. FDA has expanded the use of an asthma drug in order to help with food allergies.
Correct, and this drug, you have probably heard of it before. It's called Xolair, right? It's a monoclonal antibody. They use it for asthma, but the FDA has now approved this for people as low as 1 year of age, as young as 1 year of age. So if you have a food allergy to peanuts, tree nuts, milk, eggs, or wheat, you can take this injection every 2 to 4 weeks, and it will decrease your ability to have that really bad food allergy if you have an accidental ingestion. So if you are allergic to peanuts and you know that if you get exposed to peanuts, you could die because your allergy is so bad, you need to talk to your doctor and get this injection. Now, the sticker shock might be a bit much because if you're an adult, it's like $5,000 a month, and if you're a kid, it's about $2,900 a month. But insurance will cover this, right? But you got to think about this is a really good breakthrough because, I mean, some people are so nervous about even going out to dinner because they could have a really bad allergy to food, any type of these foods that I mentioned, and then they don't have to use this EpiPen as much if they have an anaphylaxis attack.
Wow, okay, so that's interesting. All right, and the last one, you guys, just warning, Viagra is now said to be able to lower the risk of Alzheimer's disease?
Yeah, okay, so I want to be very clear about this, okay?
Hey, you guys stop laughing over there.
Listen.
This is medical correspondent here.
This is a hard story to do.
Stop.
No, I'm saying this is tough to talk about because, okay, the journal Neurology, this is a very, very real journal, okay? February 7th, 2024. This is a brand new study. Men, I'm going to read this because I don't want people to take it out of context. Okay. Men who took Viagra and other ED medications were 18% less likely to develop Alzheimer's disease. They found a larger difference in men who used it more than just every other day. So the point is that we have to remember, okay, that this is not a study that they gave the men Viagra and then watched it. This is an association, so we don't have a real clinical trial here. But Viagra was used for other things before it became used for erectile dysfunction. It was used for chest pain. So this whole concept of the dilation is a real thing. So I know everybody's laughing about it. I'm trying to keep a straight face, but this is a real thing.
Well, and it's in context with what we're talking about because the FDA is saying, hey, you can use this asthma drug in order to treat food allergies. And so, that happens often with different medications. I think that one is super interesting too, because with food allergies, I mean, there's not a lot to help, especially with families who have those young children. You're not really sure what they're allergic to.
Yeah, you can't even send your kid to school with a cookie anymore because everybody's freaked out.
No peanut butter for my girls. So.
Yeah, exactly. All
okay,
right.
and we're going to have information for all of these, especially this one with the plastic.
Yeah,
Louisiana has a high rate of premature births.
Yeah, I was just trying to keep it together.
We appreciate you. All right, keeping it together for us. We'll have all the topics discussed here over on our website, WLTV.com.